Hello, this is March Benham-Hutchins, and this lecture is on Health Information Technology Strategic Planning. Strategic planning for a new information system or new information technology must be congruent with the organization's overall mission, goals, objectives, and strategic plan. An important first step is to identify the goals and scope of the project. The goals of the project must meet the needs of the users as well as support the mission and goals of the institution. The identified goals will then provide direction for the remainder of the planning process. In your book, they provide an example of a cardiac monitoring system. And the goals and scope of the project in this case is to implement a one-vendor solution. And the result is the selection of a single system that will meet the needs of all monitored areas in the organization. Another important step is scanning of the internal and external environment, and this is often done through a SWOT analysis, and that is the evaluation of the strengths, weaknesses, opportunities, and threats. In addition, you want to identify potential solutions and identify a course of action. Some example strategic planning goals would be supporting business decisions. That would be something like a system for charge capture. Make effective use of emerging technologies. That could be applied to the AccuNurse project, where we would be using voice-enabled technology for documentation. Enhance an organization's image. This could be to attract potential employees or patients, showing that you're able to use the technology. Promote regulatory requirements. The AccuNurse system has been shown to support the collection of regulatory data for nursing homes. Cost effective. Support patient safety. In the case of some of the examples we've seen on the AccuNurse documentation system, it shows that you can use it to summon another care provider to assist you with transfers and other needs. Support clinical decision making, and there are probably many more. It is important to identify a project implementation team, and this should include representation from all stakeholders. For example, administration, you will want managers, perhaps unit managers, maybe a chief nursing officer. There may be a variety of people involved that are part of the decision making. Technical, you need people once again to help with the decision, but also they're the ones who are going to provide the support for the system and can advise on the technical requirements and how this particular system would interface with your current systems and other issues where they should have first-hand knowledge of the current infrastructure. And then clinical stakeholders, and that would be end users such as nurses, physicians, laboratory, depending on what you're doing. Could be nursing assistants. And this project implementation team should be customized by the project. So with your AccuNurse project, you need to identify who should be part of your implementation team and why. Defining the scope is a very important step in strategic planning, and it should include the desired results. This step is when you flesh out a statement or a definition, and it identifies and describes all the work necessary to produce the final product. It should be sufficiently detailed, and it's important that it identifies the project tasks, when they will occur, interdependencies. Does this have to occur before this? Who's responsible? It establishes timelines, tasks to be accomplished and completion when they should be completed. Decision-making process, who makes decisions? And methods of communication for the stakeholders, project status reports. Now, what's important about the scope is that almost any endeavor, you're going to make some kind of change in the scope. But it's very important to recognize that if after the project starts, a change in scope could increase your costs or your deadlines. There's something called scope creep. When you start having a lot of different people have different inputs after you start the project, and they say, oh, I'd like you to do this at the same time, or I'd like this particular feature. And it's important to recognize that these little deviations from the task at hand, from the actual scope, may result in increased costs and deadlines that are unmet. So you really need to identify the consequences of these. This can be very challenging because changes from the baseline is going to be something that is going to be required, but recognizing what is required and what could interfere with the project and be detrimental is also important. It's also important to verify the scope with all the stakeholders. And this should be done as you're developing the scope. And so the final plan does not come as a big surprise. So all the stakeholders should be involved as you plan and as you identify what it is you want to do. You need to have their input in order to make it accurate and to also get their buy-in later during implementation. A SWOT analysis is an internal and external examination of the environment. SWOT analysis stands for strengths, weaknesses, opportunities, and threats. There are 3 documents available on Blackboard that will help you with this. One is a Word document, a guidance. Another one is an Excel sheet, and then there's an overview of undertaking a SWOT analysis. And this is something that will help you a lot in planning for your AccuNurse project. This is a copy of the SWOT analysis template, just one of the resources that are on Blackboard. These are not specifically for healthcare or for health information technology, so use them as a guidance and to help you when you're working on your project. This document is also available on Blackboard, and it is an overview of how you go about doing a SWOT analysis. It gives a very good definition and the benefits. It talks about the action checklist and establishing the objectives or the scope, who should be involved with it, how about information gathering tasks, to list the strengths, and these strengths can relate to the group, to the environment, to perceptions, to people. It is important to also evaluate your weaknesses. And it doesn't mean that you have to focus on them as negative, but just an honest appraisal of what they are. What are obstacles that could prevent progress? Could it be organizational infrastructure? Could it be cost? Could it have to do with the funding? What could be strengthened maybe before you even start this project? And are there any real weak links in the chain that could really adversely affect the result or the success of the project? And this is many times these have to do with people issues, such as issues of poor communication, leadership issues, motivation, and this is where we'll talk in the next lecture a little bit about change theory again. Delegation issues or non-delegations, trust. These are things that can really make a big difference in the success of a project. And when you list your opportunities, you can look at your environment, the demographic factors, and once again, this might actually be people. You may have a great IT department, your nurses may be right on board, and so the strengths may be in that department also. The availability of a new technology. In the case of AccuNurse, is this technology ready for implementation in your environment, or does it need some more maturing? Is it something that your decision will be that you do not recommend implementing at this time because of this, and this, and that it has more to do with the environment you want to use it. And also, once again, your threats, and these quite often could have to do with, they could be people, it could be sabotage, it could be financial issues, any number of things that could be a difficulty here. And so this document also lists some important do's and don'ts for SWOT analysis, and you can go ahead and review these. And this document will be available online, as well as those other the other two documents to help you use these. It's just a guideline. You don't need to include them in your paper, but they will help you think through some of the issues that you need to consider when you're planning an implementation of a technology such as AccuNurse.